And as you all know, the THCB Quick Bite from the health show floor. This is Fay Rotenberg. She is the president and CEO of Firefly Health, which is a lot more, but started as an advanced primary care online service and now has its own health plan and a bunch of other stuff. So Fay, you guys started about 4 years ago, raised a little bit of money and have been building out this solution. So tell me, what is Firefly and why is it different from all the other people saying they're doing great work in care?
So you nailed it. We did start as virtual first advanced primary care, which has become a bastardized phrase, and I do have a little bit of issue even identifying as that, because at this point there's a lot of urgent care companies.
It's like everyone says they're value-based care, but you know.
What does that even mean?
Yeah, what does it mean, right? So what does it mean for you?
What it means for us is that we are truly accountable for outcomes, and will guarantee that we are, first of all, we will take upside downside risk, but we are accountable for outcomes and lowering the cost of care while improving member experience. And that is how we've been built. We have care at the core, we built up network navigation capabilities, and then built a health plan around our care delivery and our network. I think that the comparison to a virtual first Kaiser on the plan side as an integrated care and coverage model is apt, but a big part of our business is outside of the health plan, is just us as risk-bearing provider partnering with payers.
All right, so what is the member experience? I'm now a Firefly member. Let's say I'm in the care plan and I signed up and signed up for the plan. What I'm sick, I have an issue, what do I do?
So it starts at the point of sign up, when you are actually selecting your own dedicated care team. And this is an important part because you're getting to decide, what matters to you. So is it race, is it gender, is it area of expertise, is it someone that does CrossFit, like you name it. And this team is your own dedicated team. It sticks with you. It's an MD, it's an MP, it's a behavioral health specialist and a health guide. And the behavioral health part is important because it does enable us to take on about 85% of behavioral health needs without referring out. And then this team is with you. And so, first of all, you are signing up, you are setting your intentions, what matters to you, what do you care about. We are pulling in a lot of external data, so we have our own idea of your health records, and we're creating a risk score as a result of that and your own input. But you also get to say what matters to you, what are your goals, and then we're going to support you around those. So let's say that you have diabetes. It means that you're going to be interacting with different members of the team, and this will largely be our health guide. And of course, we have, whenever you need an MP or an MD, you name it, but it really is going to be adjusted based on your own personal care needs as well as your goals.
And this is almost all online, I guess, synchronous and asynchronous?
It's synchronous and asynchronous. Our care teams practice virtually, all 50 states, but unlike most telehealth providers, we recognize that eventually you will need care in person. Whether that is a visit or whether that is a lab test or a POC test, you will need care in person. And this is where Firefly has taken a different approach, because rather than building and buying clinics in every single geo across the country, we have taken and I'd say on the other end of the spectrum, telehealth companies, which really break down at the point that you need it.
Leave you hanging, yep, we've all been there.
Completely leave hanging. Firefly's taken a partnership approach, and we have these Firefly nearby partners, which is what we call them, 1,900 of them across the country. And these are tightly integrated partners. They include urgent care, retail care, in-home care. And when you do need to be seen in person, let's say you have abdominal pain and it's something that actually requires a hands-on examination, we are going to refer you to one that is convenient to you. You'll show up, they'll be expecting you, they'll know what to do. In some instances, we can be interacting with you during that exchange. In all instances, as soon as you walk out, we're following up with you and we're closing the loop with the provider. So we're really able to manage that experience from the virtual to the physical.
That's great, because that's where there's so much drop-off.
Where most things break down.
Yeah, absolutely.
Yeah.
All right, so fantastic. So you're doing all this. You've got roughly how many humans are on the platform now?
We're growing quickly.
Growing quickly. All right, I'll take that as a number. Not sure it's a number, but close enough. Okay, but so now you're out talking to potential new customers, employers, health plans. Mm-hmm. What's the results? What are you showing so far?
So on the clinical side, consistently our clinical outcomes, really chronic condition outcomes, are 50 to 80% better than industry benchmarks. These are largely NCQA benchmarks. All the most common chronic conditions, so hypertension, diabetes, anxiety, depression, obesity, the list goes on. And then on the TME reduction front, we'll guarantee 12 to 15% reduction in total cost of care. And so that is really coming through both our care model, reducing unnecessary utilization, unit cost navigation, and then plan design. And then on the experience front, members love it. So it's an NPS high 70s, 80s, and I think that really the basis for all of these outcomes is our ability to meaningfully engage members. So that's on average 34 times a year members are engaging with our Firefly care team, and it's the basis of everything. It's how we build a relationship and trust. It's how we then earn the right to navigate people when they do get sick, and it's why they come to us instead of going to the ER. So we're seeing 33% reduction in ER visits, but it really does stem from that engagement.
All right, and for the cost reduction, I say 12 to 18%. What about the next year? So I mean, I guess the question is, can you sustain that level or some other level, or is it just a one-time step and it starts going up off the bat?
No, so it's usually we'll start at say 12 year one, and then basically incrementally about 5% additive. So it's not an additional 12-15% building on that every single year, but it continues to go down.
Right, so it's which, you know, depending on where the rest of the market is, will end up being a big gap. So that's how that's down. All right. So last little bit, tell me about the state of the company. Ballpark, how many people do you have? You mentioned 1,900 partners. How many people do you have on the team? Mm-hmm. I forget, you raised money a while back, but haven't done for a while.
We raised money in January.
Oh, this year?
We did.
I forgot, how much was that?
We didn't do a whole press thing around it, but so we raised 40 in January.
40?
Yeah.
And how much have you done before? I forget.
In our previous round was also 40.
Okay.
Or so 38. Close enough.
So hopefully you have enough.
35,
you have enough to buy this very fancy booth, at Health. And,
we're good.
You're good for a while, hopefully.
Until into 25. But
okay.
So we raised. What was the other?
So the other part was how many people do you have? How many positions on staff? Give me a scale of the Dog and Pony show that you're running.
Yeah. So we're about 150, and then for our care team, I think that we talked about all of the touch points. I think that one of the things that we do well is the ability to have an incredibly high touch model of care that's also very efficient. Yeah. So an average members, we have 5,000 members per MD, so 5,000 person panel, and it is our ability to have that large panel size and yet still have it be high touch with a dedicated care team that is what makes us work from a business perspective.
Well, I've always said, I mean, if this stuff is going to work and it's going to spread, we've got to figure out a way to make healthcare scalable. We've got to be able to scale the clinicians, but also improve the member experience. And hopefully, you're doing both. And we found out off camera that I should be a member. I could be a member, but only for the next 2 months. So I'm not sure.
You just found this out. Well, we'll figure out a way to keep you.
Yeah, it's that's a related problem, which is that when you go off Cobra, bizarrely, I'm a Blue Cross in Massachusetts. Remember when you go off Cobra, or you go into Cobra or whatever, your insurance changes all the time, which is another pain point for the patient.
Yes.
That's probably beyond your ability to control. Anyway.
Today,
all right.
yes.
Today, well, soon. I've been speaking with Fay Rotenberg. She is the CEO of Firefly Health. Hey, thanks for your time.
Thanks.